You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, facial plastic surgery. With us, we have a board-certified plastic surgeon that everyone is talking about because of the results he's getting. You will not believe who my first guest is. We'll be right back.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Andrew Ordon, MD. Dr. Ordon is a board-certified plastic surgeon that is here today to talk about the keys to a natural-looking facelift. Dr. Ordon, welcome to the show.
How are you, Randy?
Now, we've had you on the show before, and for those that don't know you, you have your Beverly Hills office and here at the Plastic Surgery Institute. Tell us about your practice.
Right. It's been some time now that I've been splitting my time between the Desert office, the Plastic Surgery Institute, which we started in 2000, and my Beverly Hills office, which was completed several years ago, and I still manage to juggle my time between the two offices.
Now, according to my notes, you have 3 board certifications. Tell me about those.
I do, Randy. I first did general surgery, then I did a residency in otolaryngology or head and neck surgery. I'm board certified in that. Then I did a residency in plastic and reconstructive surgery. I'm board certified in that. And I also sat for the boards in cosmetic surgery.
Okay, now today's topic, a natural looking facelift. Still
Right.
a lot, and we've talked a lot off camera about this, you still see that pulled, stretched look. So we want to talk about the keys to a natural looking facelift and what you can do as a surgeon to make it look natural.
Randy, I would say with every facelift consultation that I see, inevitably it comes up talking about that overly pulled, unnatural look. That's something that the people want to hear going into the surgery that they're not going to have. And the key thing to remember, Randy, is if somebody has a facelift done well and naturally, when you see them walk down the street, you're not going to know that they had the facelift. It's only the facelifts that have those giveaway telltale signs of
a tight look.
Well, there are a number of things. Losing your hair in the hairline, the overly tight look based on pulling too much, too often, or on somebody who really didn't need it. The direction of pull is probably the single biggest thing, that if you pull back, you're going to get that wind-blown or pulled look at the corner of the mouth. Face neck lift should be more of a vertical lift where it's up and back, putting tissue back where it was before it slipped due to gravity.
Now I interview, and the Wellness Hour now airs in over 8 states. It seems that every plastic surgeon has a different approach. And why is that?
Well, Randy, there's a big range amongst surgeons who do facelifting, and it involves a lot of things: age, experience, the type of training. Even amongst board-certified plastic surgeons, they may have trained more in a program that was leaning towards reconstructive surgery and less elective cosmetic. They may not have done many facelifts. They may not have done many facelifts early on in their private practice, to be compared with somebody who has been doing facelifts from the get-go. So just based on that, there's a big variation.
So art or science? I mean, artistic talent, is that
Randy,
the key?
It's both, and that's the key. It's combining the two, because this really is tailoring an art to the max. As you know, as a board-certified plastic surgeon, I do everything in plastic surgery, but at this point in my career, I am really focusing on facelifting. I mean,
in Beverly Hills, you're known as the guy for the facelift.
Well, there's some great facelifters in town, but as you know, I practice in Beverly Hills. I was trained and practiced on Park Avenue in New York, where I learned a lot of my facelifting techniques with some of the biggest names.
I've also been told, and we talked off camera, that you attract a certain type of patient, the natural-looking patient, the one that doesn't want that tight look. But I have to ask you, do people want that tight look, that pulled look? Do they come to you and say it?
Well, sure. As a plastic surgeon, it's all about patient selection, and sure, we're always confronted with patients that have unrealistic requests, that want something that's unnatural that we can't achieve.
So they say, I want to be pulled tight.
Well, for example, a younger patient that comes in that, I don't care who you are, you can pull a baby's face and get them a little bit tighter. You know, you have to have X amount going on before you it's worth doing the surgical intervention and doing the facelift. So some people just aren't a candidate. But to answer your question, absolutely. We have people that really don't need it, and they come in and go, I want to look like this, and just go, well, that's not what we do. That's not a natural look, and I would discourage you doing that.
Now, I've seen your before and afters.
Okay.
And so what is your
you
goal?
know some of my patients too.
That's right.
I've seen them out socially. And
they look good. They look good. In fact, some people look like a younger version of themselves. So what is your goal? You want to make them look younger? You want to make them look different? What is it?
Well, depends what their ultimate goals are. I mean, we're a little concerned about, wanting to change somebody completely. I had a couple of requests like that when I practiced back east. Somebody that was in the wrong place at the wrong time and wanted a complete change of their face, sort of like the Humphrey Bogart movie. But people have asked me for that type of thing, but that's pretty unusual. Most people say, I still want to look like myself. I just want to look more rested. I want to look how I did 10 years ago, 20 years ago. And in most cases, we can deliver that. Now, the modern day facial rejuvenation, it's come such a long way from when I started doing facelifting in 1980. The lift itself nowadays is totally different than when we started doing it in the early 80s. First of all, it's not just pulling the skin, but it's pulling the underlying layer of tissue which is connected to the muscles of the face.
Well, help me understand exactly what's going on to the aging face. As simple, I guess, as that seems. What's going on?
We have skin, and we have the underlying structures of muscle and connective tissue sitting on the facial skeleton. There are structures which hold it in place, sort of suspensory ligaments, if you want to call them that, but in time they start to fall. So as things give, things fall on the facial skeleton, and you see the typical signs of the aging face, specifically nasolabial line, jowls, and banding in the neck.
Okay, what are the different categories then of facelifts, facial rejuvenation? And what are the different areas?
Well, you can break up the facelift. The facelift is not a facelift. It depends where the patient needs improvement. There's the so-called just cheek temple lift, where somebody just wants lifting of the mid-face.
Is that a mid-facelift?
Well, it is. It's a variance of the mid-facelift. For the younger patient, you may be doing more on the deeper tissues. There may be less skin excision. You can call it a cheek temple lift or a mid-facial lift.
When you say younger patient, how young? Are the patients younger and younger now?
Absolutely. That it's younger and younger for elective facial rejuvenation.
What are the ages?
Well, we start seeing patients in their 40s that want to do the mid-facelift, that want a cheek temple lift to just give them a little better look.
It's subtle.
It's quite subtle,
And what does that do, the mid-facelift?
Well,
bags under the eyes? What is it?
It's not really going to help the bags under the eyes per se. It's more going to help the mid-face, where helping the malar fat pad, which has fallen and given sort of a drawn look. It helps the nasolabial line, and it helps the jowls.
So the jowls are eliminated?
Yes.
Okay, what else are you doing for the face?
Okay, so then if the classical facelift would entail lifting the cheek, the jowl, and adding the neck. Now you can do a isolated neck lift where you're just lifting the neck, but that's pretty rare, because for most people that need a neck lift, they also need some lifting and tightening in the mid-face as well.
Is it men and women?
Absolutely.
I mean, more men
10
are
years
coming
ago
forward?
it was about 5% men. I'd say nowadays it's 25% men.
Now, men, of course, I've seen some men, it makes them look very feminine.
Well, you have to be very careful there. And again, it's preserving the hairline and the sideburn. It's all about the direction of pull, not pulling too tight. I know what you're saying, and I think the single biggest thing that can feminize a man when you're doing facial surgery is the eyelids, where they lose their expression, they get sort of a glassy look, that the eyes look too good.
Okay.
When that happens on an older man, I think that
skeletal hollow look.
Right.
I see that.
Right. So if we do the eyelids on a man, we definitely want to be conservative, if anything slightly underdo, and in some cases avoid an invasive procedure and just do laser resurfacing to make the eyes better, give it a little more tightening, but without changing that the expression that's generated by the eyes.
What frustrates you in the world of plastic surgery that you see going on? Anything?
Well, what frustrates me is a lot of what frustrates the public, that I see something, and obviously I pick up more than the average person, but it's picking up on something that was obviously done.
A mistake. Would you say it's a mistake?
I don't want to use mistake.
Okay.
That I want to say that I would have done it differently. That there's always different opinions, theories, different way to approach something. But I see things that saying, that's overdone. And an excellent example is seeing certain celebrities with the eyes, older celebrities, actors, that I think have lost some of their...
Too much.
Well, yeah.
You told me less is more sometimes.
Hesitant.
What does that mean?
I don't want to mention any names because I think the celebrities, this whole thing about talking about what people have had,
Sure.
I think it's gone overboard.
So you think they're going too heavy on the eyes?
Yes.
As far as the skin over the eyes?
The skin.
Too hollow.
And, well, removing too much skin and removing too much fat, too.
What do you mean fat? Too much fat? Above or below?
Both. We have fat pockets around our eyes. 3 fat pockets on the lower eyelids, 2 fat pockets on the upper eyelids. These loosen up and start to create puffiness as we get older. So when you do upper and lower eyelid surgery, you're addressing fat pockets on both the upper and lower eyelids. And to answer your question, yes, potentially both of those areas can be overdone.
You said you see extreme makeovers every day in your office. What do you mean?
Pretty significant makeovers, yes. When you combine, doing a facial rejuvenation and then also do a makeover on the body, a woman that's gone through multiple pregnancies, do liposuction, do breast surgery, tummy tuck, then that becomes a pretty significant makeover.
Now we're talking about facelifting today, but you do everything, I guess, with your training.
Yeah, I'm a fully
From tummy
trained,
tucks, everything.
I'm a fully trained, board-certified plastic surgeon who does everything: breast surgery, liposuction, tummy tuck, reconstruction, reconstruction after accidents, cancer, etc.
If you had to use the wellness hour to get a certain message across to people about the facelift, what is that message? What do you want people to know?
I want to use this opportunity sort of to bring them into the consultation room with me here and basically tell them what I would tell them if I met them face to face. And it's that your biggest concern is not looking natural, is looking overly done, looking pulled, looking like a telltale, like a facelift was obviously done, and that's not going to happen. But with the techniques, the way we do it now, in my hands, that they will get natural results and just look better and more rested.
Now, if a woman, let's say, waits until she's 70, 75 before getting a facelift, is that unavoidable to look unnatural? I mean, how do you make the older patient?
It's just you don't try to do too much on that 70-year-old. You have to keep that in perspective. Her tissues are going to be a little bit different, and she's 70 years old, but you still use the same basic modalities that I discussed: the direction of pull, doing a combined treatment of lifting, laser resurfacing, and adding volume to the face. That's another area that we really didn't touch on yet, Randy, and that's the newest, latest concept with facial rejuvenation, is that we can't ignore the fact that as we get old, we lose volume in the face. So
what do you mean, volume?
Well, as part of aging, as I said, we have this slippage of tissues over the facial skeleton. But in addition to that, we lose filler tissue in the face, especially in the mid-face, over the cheekbones, and around the mouth.
So in the bags under the eyes area, for example.
Yes, you form bags under the eyes, but then you can also form a hollow below that, the so-called tear trough deformity, which is another example of a part of the face that's losing volume as part of this aging process.
Dr. Ordon, we're going to take a quick break. I want to get to the photos, take a look at your work, what you're doing when you talk about a natural-looking facelift. You're watching The Wellness Hour. I'm Randy Alvarez. We're talking about the keys to a natural-looking facelift with board-certified plastic surgeon, Dr. Andrew Ordon. We'll be right back. You're watching the latest edition of The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. With us, we have board-certified plastic surgeon, Dr. Andrew Ordon. Dr. Ordon, we're talking about facelifting today,
Right.
Natural-looking facelifts. And for those just tuning in, define the difference: natural-looking and, I guess, unnatural-looking.
Well, I think natural-looking just means that you look at somebody and they go, "Wow, they look pretty good," or "They look great," but you can't tell for sure whether they've had surgery or not. And
Do you want to make them look younger? Do you want to make them look great for their age?
Well,
You tell me.
both. I mean, both. I mean, they sort of go hand in hand. Younger for their age and just make them look better.
Let's talk about ages for a moment.
Okay.
Put you on the spot. Somebody 70, they could look what after a
Well,
good
it depends
facelift?
if it's an ideal candidate, not overweight in the face, good underlying bone structure, is in good health. I mean, you can often get 20 years on somebody.
Is that right?
That's correct. And somebody, doing
Somebody 70 can look 50.
with a full facial rejuvenation, combining lasers, some volume, and doing a thorough face neck lift, skin and underlying tissue, in the right patient, absolutely, 20, 25 years.
What about the spouse, the partner? How many years do you hear from them? My wife looks 20 years younger, 10 years younger.
They just say she looks younger and she's happier. I mean, they realize that this surgery is surgery of the mind as well, and they see that their partner, their spouse, is just feeling better about themselves, not necessarily in exact 5 or 10 years better, but just being happier in general.
Now, I'm not trying to endorse you here.
Okay.
And I'm going to say, I'm just asking the questions, but I've seen some of your before and afters.
Okay.
And I'll look at a before and I'll look at an after, and some of your afters look like the daughter of the before. It's just, I mean, literally, like you say, a younger version.
You will see that in the right patient, the ideal candidate, and we went over that a little bit. You will see some really dramatic improvements.
In your view, who is a candidate for a facelift? At what point, at what stage should somebody start to do something? Maybe not a full facelift, maybe just some.
Well, we have the full gamut now of non-invasive maintenance type things that we can offer to patients.
So start from very basic.
Well, even in your 20s, you should be using some skincare products, maybe a product that's going to give you a certain degree of exfoliation, something that has a little glycolic acid in it or vitamin C.
Sun damage in the desert, maybe in Beverly Hills you're seeing. What do you see more of? Sun damage here or there?
All of Southern California. I'd say more in the desert setting, though, than Beverly Hills, just because I think people are more outdoors. Especially, and it's drier, so it's going to have more of an aging effect on the skin. But that's what brings a lot of patients here for facelifting, is just the effect of drying and sun.
So do you do a combination of like laser or peels and facelifting? What do you do?
Yes, when you're talking about purely sun-damaged skin tissue, then you're talking more about a resurfacing technique and filling. And what I prefer to do these days is the erbium laser resurfacing with some fat transfer.
You do a lot of that?
We do a lot at the, we have all the lasers on site. We have lasers for brown spots, red spots, spider veins, and the laser for resurfacing.
I talked to a plastic surgeon in San Diego, and he said, Randy, frequency is the key. You want to ask your surgeon if they're doing a lot of that procedure.
Absolutely.
So the fact that you do a lot of facelifts, how does that benefit the patient?
Well, Randy, the more I do, the better I get. And that's why I'm so excited about it. I love doing facelifts. I do them on a regular basis. Makes me a better surgeon.
Are you getting better all the time?
Absolutely.
I guess it sounds like a obvious question.
My best facelift was my last facelift. It's an ongoing education that I gain little nuances in my technique every time I do an operation.
At the break, you said you wanted to mention the Institute, the Plastic Surgery Institute.
We have a real special place where we operate here. Number one, it is a state-accredited ambulatory surgical facility. We meet all of the same safety requirements as any hospital here in the Valley. That means that we have all the latest monitoring equipment, backup power, those type of things. We have a wonderful medical staff, including nurses, technicians. We have provisions for people to spend the night. I insist that all the facelift patients spend the night in the Institute the night of surgery. That makes a huge difference as far as making sure they get all the right care immediately after surgery. And it also, it eliminates a lot of the complications by having them not move too soon. It makes a huge difference. But the facility itself is special because it's a converted mini estate. It's a gated, formerly was a house that's now been transformed into a surgical clinic with consultation space and
It's very private. It's very private.
Well,
I guess
that's what I
people
love
want
about
that.
it. It's very private. It's off of the main road. It's off of Route 111 with a private entrance, spectacular views, very quiet, more a residential setting than a commercial setting.
Everybody comes on my show and says, I have a great staff, friendly staff, and it becomes very cliche after a while. What about your staff?
Well, I of course am biased myself, but that bias has come over 5 years of working. I essentially have the same staff that I had.
Why is that important to the patient? Patients always email us and ask us that.
Patient picks up the underlying relationship with people in the office right away. I mean, that if they sense that there's animosity or tension, or if people aren't happy, they pick up on it. And I've seen that. So having the right chemistry in the office, these patients come in, they're extremely nervous, before elective surgery. You need the right setting, you need the right people around you, and I have that.
I think people, need to know that you work with Dr. Roy Winston.
Dr. Winston and I have been together for 5 years now. He's the medical director at the Plastic Surgery Institute.
Dr. Ordon, I've talked to more than a dozen surgeons on the show. And what are you going to tell me that's so different about your facelift? Because truly, and this is what the cameras aren't picking up, off camera, you really feel...
You're not holding any punches today, are you?
Yeah, well, you really feel that you're different. So what are you going to tell me that's any different?
Well, I do. I really feel that it's taken me over 20 years to develop a technique, and I think that this technique really addresses the concerns of both the patient and...
Give me an example.
Okay.
It addresses the concerns.
Well, first of all is the placement of the incisions. Is preserving the hairline, so you want to make an incision in front of the hairline.
Now, when you say that, and I'm sorry to interrupt, it implies that not everybody's preserving the hairline.
Absolutely.
So how does your
and you've
technique
seen
differ?
that more in the past that people were placing incisions back in here, and as you pulled up in the temple area, you removed hair-bearing skin.
So women can't wear their hair up.
You can't put that back. I mean, in revision facelifts, I do attempt to release that hair-bearing area and to rotate it back in towards the face, but that's a difficult thing to do, and you can only get so much improvement.
Okay, so what else are you doing that's different?
What else? The incisions, it's an artistic curve. There are no straight lines with the incisions that we make in facelift. They're all gentle curves hugging the natural anatomy.
And that's not always going on?
No, you see a straight cut. Okay, we make a cut
Why
in front
does it
of
go on?
Well, because the people haven't done enough of them and don't have the experience.
You said don't make me say anything negative about other surgeons. Do you think there are certain people that just don't belong doing facelifts?
Well, I think like anything else, if you want to be good at something, you should do as much due diligence as you can to learn the latest techniques, whether that be visit a surgeon, go to meetings.
And not everybody does?
No.
Okay, so we'll go back to you again. Okay, so you hide the incisions, placement of the incisions.
Hide incisions, it's all gentle curves. There are no straight lines in
Interesting.
incisions with a facelift. We go inside the ear here, inside the tragus. Now there's a special technique that we do with our thumb to make sure that we're redraping the skin so that there's a little extra skin at this spot so that there's no pull.
Now, does this contribute to having a natural look? More than just hiding an incision?
It's both. Exactly. The next key area is the earlobe, and you've seen this.
I see that all the time.
You've seen the Spock look, the attached earlobe look, the loss of the earlobe. So what we do is that when we redrape the skin, we make sure there's extra skin holding the earlobe up, and we close the earlobe in such a way that you maintain a normal full earlobe. And then the incision in back of the ear is placed not in the crease, because that can move, but up on the ear. And finally, we go up high enough in back that you can't see an incision in back here. We go up high enough.
So you must see these all the time?
Well, I mean, look at the time I just spent.
So when you're out at a function,
on an incision,
you see it?
I mean, I can
So this
sit
is
here and
important
talk.
to you?
Yes. I mean, there's a difference.
With that, what else are you doing that's so different?
Well, then as we get deeper into the operation, it's how I handle the deeper tissue. It's a more aggressive handling of that.
The muscles, the fat. When you say deeper tissue, what do you mean?
Yeah, that we do a more extensive dissection of the layer of muscle and the connective tissue, and then I deal with that tissue. I separate that tissue in such a way that we get two vectors, one to really clean up the neck and the angle of the jaw, and then I do a separate lifting of the mid-face cheek tissue to get the maximum.
All for natural lifting facelift.
Yes.
I've interviewed some great people on my show.
Okay.
And secretly, off camera, they always think they're the best. Do you think you're the best
Well,
at
I
what
think
you do?
you need a lot of confidence going into this. I mean, that's a big part of being a good surgeon, is having the confidence to deal with.
Well, you're
what
probably
you're
not
doing.
asked that very
But
often. So, do you think you're the best? I mean, one of the best?
I do. And,
Okay.
I can honestly say that based on my experience, my training, and how many of these I've done.
And the results?
The results, and I care. I mean, you can tell that I'm into this.
Dr. Ordon, we are out of time. Thank you for coming on the show. But final recap. Lay some fears to rest here about the facelift. What do you want people to know?
Well, I want people to know that you can get safe surgery, you can get natural, lasting results, but going into it, you need to do your homework, you need to do your due diligence.
Like homework, how so?
Well, you should find out as much as you can about the procedure. In finding a surgeon, you should interview him, you should see his work, you should ask to see patients that have had facelifting, the opportunity to talk to them. You should have the opportunity to see where the procedure is being done. You need to ask the surgeon how many of these he's doing.
Dr. Ordon, I want to thank you for coming on the show. Honored to have you on the show.
Thank you, Randy. Nice to be here.
You've been watching The Wellness Hour. I'm Randy Alvarez. If you would like information about future airings of this program or other show topics, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez.